I miss you.
You too.
Hey everybody, it's Kevin, it's Donna, and we're back for season 2 of the Med List. I'm honored that able to be here with Donna and to start a new year and a new season. We thank everybody out there. I think Donna and I were both blown away when looking at the number of individuals that were listening. Very thankful for each and every one of you. I know that it is definitely not me; it is Donna, and it is our guests. Bring me in, and I appreciate each and every one of you for tuning in. Please know that if you have a guest or if you have a topic that you'd like us to cover, then just reach out to us. You can hit us up on all the social media connections that we currently have and subscribe and share, I guess, there. Donna, anything before we get this next season kicked off?
Yeah, just please share and let's all be med strong together in this new year. That's what we want to do. And I have a workbook coming out and my audiobook coming out. So lots to happen in 2024.
Oh, that's so cool. So Wellhood Publishing has lots of really cool things going on. You can get a hold of Donna with all of those things and then follow along with the things that Donna's doing with her workbook. I feel like it is so interesting, Donna, that you've done that. You went from writing a book, right? That there's a lot of people who write a book, right? You write a book, put it out there in the universe and hope people can gain something from it. But for you to take the time to be able to break that down and make it very actionable for individuals, I really appreciate that. And have you had any good feedback so far?
So I am still finishing up the design with it. So feedback soon, but the few folks that have seen it so far, they're pretty excited and think it'll be very useful.
Oh, I love it. I love it. Well, that's so cool. Well, I'm going to get this show started and we'll go have some fun. All right. So fun episode today. We are talking about acupuncture, but we're also talking about a really incredible individual, Donna, that I'm thankful that you brought into our circle here. I'm going to bring her up on stage for us so you can introduce her to the whole crew.
Sure. So, and today we have with us Bernadette Eichas, and I'm just so happy that you are here with us, Bernadette. I'm going to probably embarrass you just a little bit, but so Bernadette is a RN, and she works at in a cardiac intensive care unit. But what's really unique about what Bernadette is doing is that she's in her third year, I believe, of her master's in acupuncture. And I've had the pleasure of meeting Bernadette, talking with her, really getting on the same page about deprescribing, healthy outcomes, and in her side of things, working with people to get through issues and to be able to be treated via acupuncture. In just this past fall, we were able to combine our expertise, if you will, and be able to help patients both on the medication side and acupuncture side of treatment. And it was just such a wonderful experience for us. I also want to just before I have Bernadette say hello, is just to I'm wowed by all of your accolades and the registrations that you have in critical care and progressive care and cardiac medical certification and cardiac surgery certification, and it's amazing what you've done. You're so beyond just, I don't mean to say just an RN, but you've really specialized in you take what you do so passionately. And I see that in acupuncture too for you. So welcome, Bernadette.
Thank you so much. And yes, I am very embarrassed right now. So
you've earned it all.
I love the embarrassment because it really lays an interesting foundation for the conversation. You know, sometimes you can have a guest on and this is what they do. Like they have this given pathway and this is what they've done in their lives. But for the audience to understand, like I've worked with nurses that are working on the floor, nurses that go from working on the floor to working ICU, then working ICU to becoming a specialist inside of that space. So there's a ton of training and education to do what Bernadette is doing. And then for her to be able to recognize there's some additional skills that on top with this acupuncture training of an additional 3 years of study. Just so impressive, Bernadette. Please, if there's any other details you want to introduce to the audience, please do so now.
Yeah, I mean, I think nursing is an amazing field where the opportunities for education and continuing education are just endless. And it's an opportunity to really distinguish yourself as somebody who's dedicated to high quality patient care. So to any RNs listening or potential nursing students or anything, I highly encourage you to find fields of medicine that you find really exciting and to take that extra step and, yeah, distinguish yourself.
Oh, that's
Yeah.
so cool. Yeah, I think that the distinguishing thing for me, Donna, is that I guess not to go too far, but I know you guys work together on a patient case. And I thought that would be really interesting to start the show out and just kind of talk about a real world example of how two colleagues work together and try to help an individual with a unique problem.
Yeah. So I'll start off, Bernadette, if you want
Yeah,
me to.
sure.
And I think what's really interesting is when we first met, I was actually doing a program for interprofessional education for pharmacists and acupuncturists. And how neat was that to have those two groups together? And I was able to speak on the book MedStrong, and you came right up to me and you're just like, oh my gosh, this is amazing, we need to talk more. And you really just pursued working together, and I love that about you didn't give up on getting all the people that needed to be involved with pharmacy going into the acupuncture clinic where you're studying. So I thought that that was amazing. And my pharmacy students and along with you, Bernadette, as a student of acupuncture, we were able to really work through patients in such an exciting way. I think it was so
Yeah.
enlightening for both parties, for both industries, if you will, of the healthcare world where we represent. So, and I do remember like just talking to people and saying, well, what's your, you're talking about pain or some different things that they were feeling, maybe muscle cramps or whatever it might be. And we're going, oh, I think a medication's doing that. So we're
Yeah.
able to really say, oh, you're actually treating some side effects, and maybe we can eventually get the patient off of some of these other products.
Yeah, and thank you again for being so open and willing to come and speak with us. I loved that event, and it I was really excited when our professor kind of suggested you to come and speak with us. I think this is a huge field of medicine that is something acupuncturists get really excited about. So I think deprescribing and really acupuncture, they go hand in hand, I think. So this was an awesome opportunity, and I really appreciate you working with me through it. So thanks
Oh,
again.
wow. Well,
Yeah.
you said something that's a great segue then, Bernadette. You said that deprescribing and acupuncture go really hand in hand. And looking some things up prior to the show, acupuncture is a really interesting additive service at some very large medical institutions. Like they're adding acupuncturists onto their crews, and they're leveraging that as an additional therapy to be able to help with side effect profiles and medications and so on and so forth. So it's
Yeah.
interesting to think about the algorithmic pathway. In other words, like when you're making a medical decision, how you decide on this and then this and then this to be able to try. How did you run into this first, Bernadette, with going into acupuncture or arriving upon it yourself?
It came along as a suggestion from a friend of mine for some musculoskeletal issues. So I was a little nervous, didn't know what to expect, went, had a lovely experience, felt amazing. And then down the road, life happens, years go by, and I became a patient. And there's a saying that nurses are the worst patient. And I think all of my providers would agree with that statement that we are terrible patients. But it was a very humbling and eye-opening experience for me where I kind of realized how um, assertive you need to be to advocate for yourself and to get the health outcomes that you're looking for. And even with that, and working with specialists, providers that know that I'm a nurse, know my medical background, still not getting what you need, and then being able to connect with an acupuncturist and actually starting to see some results and starting to appreciate what health is and maybe start to kind of redefine what is health.
Yeah.
That's kind of how I stumbled into it, and it just really inspired me. Um, you know
Give us this feeling inside your head, Bernadette. If you're going in for your first acupuncture appointment, we've got a lot of patients and clinicians listening, and they have no idea. They're just like, I know there's needles involved, right? Let's just go to
Right.
that baseline level. When you're going in, what's kind of going through your head for expectations? And then what did you experience that really made you go, wow, this is different than what I might have anticipated overall? And I'm thankful that I got the suggestion to go in.
Yeah, so, I was working with my friend who I love, she's amazing. She's a licensed massage therapist, and she's brilliant. She's done a lot of, continuing education, she's very aware of, like, multiple areas of health anyways. So I saw her, she recommended, "Hey, I know this acupuncturist. He's amazing. He was a physical therapist first, and then he became an acupuncturist. Like, you should go work with him. I think you're gonna get a lot out of it, and then, like, we can work together again." And so I went, and I wasn't sure what to expect, and he was just a very, approachable person that I could talk with. We went over some systems. He asked me a few questions, and yeah, um, he made sure I was comfortable, treated me. Yes, there's needles. Um, I don't know. There's different size needles. We can work with patients that are sensitive. That's not the only therapy that we use. Um, And yeah, I wasn't really sure what to think. He told me, like, give it 3 maybe treatments. We'll see from there. And I remember waking up the next day, and it was like I was going for, like, shoulder and neck tension, and when I woke up the next morning, I felt like a bobblehead. Like, my neck just felt so loose, and my head just felt so much better, and, it's just something that you really start to respond to, and
Wow.
then you start to wonder, like, what else can it do to help me?
Yeah.
Um yeah. So
Did any part of you after that, and Donna, please jump in here too, but did any part of you afterwards, because for those listening, with acupuncture, pressure manipulation, sometimes some electrical stimulation, some people use
Mhm.
magnets. Like there are a number of different techniques, not just needles going into these
Yeah.
350 plus zones, correct, Bernadette? But with that, there's a lot of studies that are showing that they often take acupuncture and compare it to sham acupuncture, which that means that sometimes that means the needle is not going as deep. Sometimes it means that there's needling and there's actually no penetration for the needle. But in other words, when you're doing a drug study, you usually have a placebo, what you've heard of as like a sugar pill, and then the actual med. So we're testing the placebo effect, what our mind and body does to thinking we're having a treatment versus the actual treatment and comparing them back and forth. For you, Bernadette, when you went in and you know all this literature because you're a medical scientific mind,
Mhm.
what did you think between all of those things the next day? Did you think, is this just placebo? Or did any of the other dots connect to go, nope, this is more than that for me?
I think honest if I'm going to be honest with you, I think my first thought was like, I didn't realize I could feel like this, and I haven't felt like this. So I knew something, I it was just one of those things where it's like,
It
this is
worked.
new, and I've changed one variable, and that was I went and saw an acupuncturist.
Yeah.
So,
Wow.
Yeah.
yeah.
And it is, and I just want to back up a little bit, Bernadette, because you had mentioned something on your visit, and I found this when you were with the patients that we were working with. You had said, it was very comforting and it was comfortable. And what I found is there is a comfort that
Yeah.
is very different than a doctor's office when you're in an acupuncture um, facility, if you will, or acupuncturist room. It is very friendly, very calming, and you can kind of tell with the individuals as you go through and you ask, how are things going? How is this? How is that? And you're literally going through every body system that you already have a record of from a previous appointment or some information that you have. I think patients feel that wow, I'm actually being listened to. And yeah, that worked really well. I felt really good after that. I really didn't feel that, or I had a couple of days of relief. I understand this might take some time, and that worked for that. Could, I'd love for it to extend further. And I found that that was really quite a wonderful atmosphere for patients. And I have to say, all of my students who um, were with you in interviewing patients, I just loved that dynamic and the feeling that they got, and how important it is to take time with the patients instead of the rush, rush, rush of typical medicine as we know.
Yeah. Well, thank you. Yeah, I think environment is really important to our patients. And I was really impressed with you and your students interacting with our patients. And I think it was such a great opportunity for our patients to feel safe, having these conversations about their medications with Western trained pharmacists. Like, this is a very unique opportunity, and I think it sets a different tone to our patients, to have those discussions in the clinic versus a doctor's office, like you said. So
Yeah.
I thought it was great that I think the conversations that they had with you regarding their medications are conversations that maybe they don't feel comfortable having with their doctor, but might inspire them or empower them down the road to start having these conversations. So I thought that was great. And I was, again, really impressed with how awesome the students were with our patients. So it was great, honestly.
How synergistic. I think that one thing for the audience, if you aren't familiar with what Bernadette and Donna are talking about here, an interesting kind of interplay happens there that I'd love you to describe a little bit further, Bernadette. A lot of folks, when they hear acupuncture, they're thinking pain, like they're thinking musculoskeletal pain, back pain, something like that. That's why I go and see an acupuncturist. Usually a story may be something like this. I had a friend tell me I should try this. Like, I've heard that so many times. Like, a friend told me I should try this, and
Yeah.
you should try this guy in particular, right? But tell us a little bit more about how much further acupuncture reach. I mean, we've talked a little bit, and if you can go into it like on this is how it can help with one medication side effect or another, which is great. But how can it help with other disease states, or what other disease states may someone come and see an acupuncturist for?
The beautiful thing about acupuncture is that it's a traditional medicine that's been used for thousands of years. So we are very fortunate to be living in today where there's stethoscopes and blood pressure cuffs and everything. But when this medicine was formed thousands of years ago, we didn't have that. So it's, let me think. Um, it's using the laws of nature to apply to humans. So humans
Mhm.
are a part of nature. There's concepts of yin and yang, um, and you start to kind of explore that. So I think for most of us, especially like me, when I first started the program,
Yeah.
the yin and yang was just a symbol that I drew in my notebooks growing up in the 90s, but it's actually like, very profound effects of, this dark and still, which is like yin, versus light and expansive, which is yang, and there's a spectrum. So, like an easy, relatable idea will be like December 21st is like the winter equinox, which is like most yin, right? So it's the darkest day of the year. Now we're getting a little more yang in here. The days are getting eventually a little bit longer. So, we have this balance, and kind of where does the human body, like, how can we use these concepts that we see in nature to
Yeah.
help our patients?
And
I don't
those
know
like
if that's helpful.
no, it's
It's kind of, yeah, I
well,
try
and
to
I
keep
think
it
it really
basic.
introduces that traditional medicine aspect that, when I'm looking through and trying to find why does acupuncture work? It's
Yeah,
interesting like how many theoretical thought processes there are to go in Western medicine. We cannot accept the Eastern medicine dialogue. So we have to be able to insert our own thinking into it. And
Right.
oftentimes you'll see things about inflammatory like recruitment or modulation. So in other words, you poke a certain area or you insert something in one place, and now your inflammatory factors are going to change there and either decrease inflammation or change blood flow or something along those lines. Others have been immunomodulatory, that they're changing the way your immune system is reacting to a given area, but nothing that's been like totally cemented down. And then looking further, I guess the interesting things that I had seen over the years are some really interesting studies on nausea, insomnia, and things related to like mindset or ability to relax in general, anxiety, for example. And so when you went through the yin and yang breakdown for us, when you're going through your studies individually right now, where do you feel like we are missing an opportunity in Western medicine most to deploy something like acupuncture?
I think something that I appreciate, I've learned in acupuncture, which again, I'm still a student and I am learning. So I am scratching the surface of thousands of years of traditional medicine. Um, I think is that the human body is supposed to be in balance, right? So we have this yin and yang, and these symptoms occur because there is an imbalance, there is a disharmony.
Mhm,
So I think what's great about acupuncture that kind of separates it from how we treat diseases in Western medicine is mostly it looks at like why these imbalances are occurring, and it
mhm,
helps you kind of reset the tone or maybe try to reestablish some semblance of balance to help with these symptoms. So you asked me what kind of patients would benefit from acupuncture or what else if it's not just pain.
mhm.
I find that a lot of patients come to us as a last resort,
Right.
um, once they've been through the hospitals or the not the hospital, but, once they've
Mhm,
been through the medical system, maybe they have a disease that, um, there's no cure. Its treatment is just symptom management, it's essentially palliative.
mhm,
So, they don't really know what to do for this patient. Maybe they go to a few specialists, they try a few things, some work, some don't, and then they come and see acupuncture. But
mhm.
we can help people before they get to that stage. Yeah.
So,
Wow.
and Bernadette, we talk a lot about this too when we were doing this pilot program. We were talking about how complex the patients were and that they do have long lists and there is polypharmacy involved. And we there was one patient who we didn't see, but she seemed to have so many medications, and I was just like, oh my gosh, I'm so concerned about her. There could be I can just see her falling on all of these meds because there was so much issue. And then, sure enough, right, she couldn't make the next appointment because of a fall. So like these are complex patients that we saw, and they are on so many medicines, and there's so much prescribing cascade happening. And you had talked about something too, or you'd asked in some of our focus points that we were touching base on, but you mentioned something about like OTCs, and I think it's so important that we talk about what are the patients trying to treat themselves because they're not getting the answers or they're not getting the relief or something they're taking is causing more discomfort or imbalance even, so now they're seeking more medicine. And then they start, we often hear people say, oh, I'm on a treadmill, I'm on the medical treadmill, right, of going to see this doctor, taking this medicine, going to see this specialist. And when instead they finally go, I want to step off of this treadmill, I want to try something completely new, and they're going to try acupuncture. And then here we are, right, you have this long list of meds, and you guys are going, oh my goodness. And what do we even concentrate on first? I'm sure, just like me as deprescribing, like which med are we going to try to reduce first? So with these complex patients, how do you determine what is out of balance when there could be so many things out of balance.
Right. And I think that's what was so great about our clinic was that it's helpful to hear you review with the patient. Okay, so who put you on this? Why are you on this? What have you noticed since you've been on this? And then you kind of hear their medical journey. I thought that was really helpful for me, especially
Mm.
with a Western background, because I've been in patient care for, gosh, 15 years almost now. So hearing the story, you can almost kind of like teeter-totter along with them and go along and follow them through it. So, and a lot of times these details get left out during my intake as well.
Mm.
Even though there's a section for like significant past medical history, things always fall off of there that patients forget to mention, or, it happened so long ago that it doesn't really matter anymore, but it can be helpful. I think the beauty of acupuncture and our clinic was to like work with the patient and see what areas in their life we can make the most difference. What is their biggest main complaint? I even had a patient in the clinic that wasn't sure what her main complaint should be. She
Mm.
listed a couple different areas of her life that, you know, any improvement would be great. So that's something that we kind of work on with our patients as we go through our treatment.
That's great.
With that, there's a phrase called we document, but we don't listen. And I think Bernadette, you were sharing a story when we were offline that I think is really special for other patients, my family members included, that have felt like they just literally have not been heard. Like they go in and they have a problem and they're trying to get an answer and they feel like they're doing what's right in the current medical structure. A quick side story I think that is really interesting for anybody listening is when it comes to medications being deployed early on in treatment, the one fascinating thing is something like this. Just recently, the FDA issued that they're going to be looking into some side effects of a certain medication class called GLP-1s because there are a number of side effects that are popping up amongst individuals that they need to make sure that they're true or not. But those include things like suicidal ideation and hair loss. And so once you go on down a medication journey that you are literally taking a poison, some things happen to your body that are negative overall. And it always is a curiosity to me why we don't emphasize more Eastern medicine and non medical components like acupuncture earlier on in treatment, because honestly, that the side effects and the issues are so low. One thing I wanted you to touch on, Bernadette, that is oftentimes thought about between individuals is how do I know? And I know the answer to this, but I want you to tell our audience how it works and how it goes along. How do I know the needle is clean? Like, how do I know when I go in that there isn't an infection risk? Because oftentimes, like that's what you go to the NIH or you go to any reputable source, and they're like, "What are the contraindications to acupuncture? Infection." Dispel that one for us if you can first, and then we'll go on to the next more exciting piece.
Sure. So first, I would just like to say I think that's fascinating about that medication, and I agree. I mean, I think that's a huge part of informed consent is that we have to educate our patients as to the benefits and potential risks. So, potential risks of acupuncture. Acupuncture is a very safe medicine. Yes, there is a risk of infection. However, we use alcohol to swab, like rubbing alcohol, the same type of alcohol that I would use for a blood draw in the hospital. Um, we put the on the acupuncture point before we needle it. We use single-use sterile needles. They are a one-time use, period. We have a clean needle field. I got certified in my clean needle technique before I entered clinic. It's a requirement. It's something that we have to be tested out of. Um, we get training on bloodborne pathogens. We get training on suspicious, if we see a swollen site, if we see something that has pus coming out of it. There is training, and it's very clear what is appropriate and what is not appropriate during the acupuncture appointment.
Beautiful aseptic technique. I love it. Yeah,
Love
I think outside of the aseptic technique now, that we answered that, and I think that's one of the biggest like hindrances to getting people to try things is a worry of the unknown. So I really appreciate you taking time to talk about that. The other
it.
piece that I'd like to be able to give a little excuse to our medical world is there's also a worry of the unknown, right? I mean, if they don't feel like they have an answer for you, Bernadette, then trying to say no, you don't have something can be a really, in their mind, logical thing to say. Like you don't have a problem because I can't identify it. But
Mhm.
what would you say to our patients that encounter that? I mean, I know from a medical practitioner standpoint, that is really poor bedside manner. It's really terrible as a human being to make someone else feel that way. But when you're a patient and you're feeling so disempowered, what would you give them? What nugget of wisdom?
I think for me, it was really important just to remember that the human body is resilient, and I think there is a mind body like if you there is a mind body connection. You can't dispel that. How can a medication affect your
Mhm.
body and also cause suicidal ideation? Like that's pretty crazy to me. Anyways, I digress. But I would encourage patients to listen to their body. I actually specifically told my provider who was trying to get me to take a medication that I did not feel comfortable taking due to side effects that I was aware of. That my body is trying to tell me something's wrong and you're trying to tell me to shut up. And that was how I felt. And
Mhm.
I think if your body's telling you something's wrong, that's something you can listen to. And it's not wrong to pursue what
Mhm.
options you need in order to fix the problem or at least get some relief for the problem.
Yeah.
Love it.
Um, so changing gears a little bit, I know we talked a little bit about what can be treated in regards to acupuncture, and I am fascinated with the various charts I saw when we were in clinic together, and also a clinic that the acupuncture students had put on for the rest of the college was the ear technique, if you will. I'm probably not even saying it right, but and I had just learned about how there's this, what is it called? Battle acupuncture, where the ear is what's exposed, and there's so many points on the ear that it's a place
Yeah.
that you can actually access in order to get some acupuncture benefits through.
Yeah.
I'm looking at those charts and I'm thinking literally every system is there. There's an acupuncture point, if you will. So could you just kind of explain a little bit about those points? And I think there's multiple ones throughout the body too. So maybe just explain that ever so briefly, if you don't mind, to help us
Sure,
out.
I can take a stab at it, no pun intended. But so I, that was so bad. Sorry. I don't know if you've ever seen, but a lot of auricular is the technical term for ear acupuncture. And yes, there is the battlefield acupuncture. There's also the NADA protocol, and that's the de stress event that we do at um, MCPHS for our students. So, yeah, it's also used a lot in like recovery and like drug rehabilitation. So, a lot of the basis for these points is actually when you look at um, a fetus in the womb, it's kind of shaped like an ear. And a lot of those points correspond to that area of the body. So that's one way of looking at it. That's just one. There's many interpretations and many different variations of that.
Awesome.
Um, it's pretty cool. It's pretty powerful. You wouldn't think something in your ear would have that much of a difference, but yeah, it's pretty powerful. And as far as other points, I mean, you saw there's over 400 points on the body, different channels, meridians, from head to literally your toes. There are
Yeah.
points on the body, and, it's great for people that, especially our older patients, maybe they can't, their mobility is restricted, or there's
Mm,
positions that maybe they're not comfortable, like if your
mm,
back pain is really bad, maybe you can't lay on your back. Maybe you have to sit up in a chair for treatment. Maybe, there's other considerations that we can make
yes.
to make this medicine really accessible for our patients and treat their concerns.
I love that. And I love the whole fetus analogy. It kind of takes you back to the 2000 years and
Yeah.
pretty cool.
There's a great book for anyone who wants to look into it. It's The Spark in the Machine, and it talks about that a lot. And
Yeah.
I listened to it before I started acupuncture, and it was just awesome. So it's a good little intro for anyone curious.
Nice. Thank you for that.
That's
That's great.
that's
Yeah.
so cool. I was reading an article before the show too. That was a Times Magazine article about why acupuncture is going mainstream. That they put that a little while ago, and they were doing the same kind of song and dance we've talked about a little bit here of just pain, anxiety, headache, or some of the main components that are connecting the dots. They're
Yeah.
all together. But I was really wondering when we talk about mainstream medicine and how we end up taking something from this conversation where we have a lot of individuals that may have never heard of acupuncture, may have never experienced it previously, and pulling it into mainstream medicine. How do we do that, Bernadette? Like, how do you feel like we can merge those elements together successfully?
It's a great question. I think we need to start somewhere. So honestly, I think even just Dr. Bartlett being so generous as to letting me work with her students is a great place to start to kind of introduce one another to other fields, other professions, and how we can all work together to help our patients. Again, I was really inspired by the care that I received from my acupuncturist. And when you're at the bedside taking care of patients and you wish there was something more that you could do for them because what's happening is not quite enough, I think that's kind of where this medicine can start stepping in and helping out for the patients that would be interested.
I feel like Donna, we'd both thank Bernadette for that and then challenge one side of it and saying, if you have osteoarthritis, one of the common things that you can take will hurt your heart, will hurt your kidney, will hurt your liver. And there's something that could be worth giving a try first, right? To see if that can cause or create a little bit more relief related to pain. And I think that that's one thing we end up doing so often in medicine is we exhaust, right? We exhaust the body of all these options. How many chemicals can we put in there and see what it can do and hope that it does something before we go to any traditional routes, right? Cognitive behavioral therapy, physical therapy, diet and exercise, acupuncture, like those are all things that are ladder because we want the initial like gratification elements. But the one thing I love about Bernadette's story is literally it's the next day you're feeling like a bobblehead, right? And so there is a very significant relief that can be experienced by these patients. And I think that's what I'd love to see, Donna. Like I would love to see more often at the counter and in the physician's office that we're saying, you know what, you could take these medications or I can recommend these medications, but first
Yeah.
maybe try this. Like this could be something that you could really
Right.
benefit from and avoid them altogether. But I'd love to hear your thoughts there and how you've instilled it into practice after meeting Bernadette.
Yeah, so and Bernadette had forwarded kind of some commentary too when we were thinking about this podcast about the non-farm side of things, right? So, what do we choose to do non-farm to try to treat something versus going right to medicine, and how involved are pharmacists with that? And so, I think what's important is that we do think about the non-farm elements, especially for me being specializing in geriatrics, there's so many limitations to the medications that we might be available and appropriate for an older adult. So it is like applying the heat and maybe doing some massage or various things like that, and also acupuncture. So yeah, starting to recommend acupuncture, and I have to say that not only not only meeting Bernadette, but having some family members who tried acupuncture and seeing the results that they got out of it, with chronic um, um, concussion headaches that were post-concussive headaches. It was incredible to see that change come through. It did take weeks of
Mhm.
therapy, but it worked. And just to see that relief, because nothing's working. Nothing is working for that type of headache. So seeing that, I think, is really important. I really think it's important that we consider every disease state as having an opportunity to be treated alternatively. We talk about it in school. We talk about it when we're teaching our students that, okay, here's the farm. What's the non farm? We talk about it all the time. Every
Mhm.
single disease state, we're talking about non farm. So, yes, we should be talking more non farm with our patients. And I understand if you need relief right now, but this might not take care of things down the road. Like Bernadette said, we might be taking care of something, but not necessarily curing something or having something back in balance, if you will. So maybe someone's suffering with migraines,
Mhm.
and maybe, yes, we do need some migraine medicine right now, but maybe eventually, throughout that period of time of acupuncture, maybe we can alleviate migraines in general for the patient. I also think it's really important for I've seen it being used for hormone issues, and um, even for menstrual cycle issues and things like that. Like, it's amazing how how versatile and appropriate acupuncture can be for folks of all ages.
I love that. Yeah, the breakdown that I see in front of me, Bernadette, is dry mouth related to radiotherapy, fatigue, headaches, increased general wellness, insomnia, nausea and vomiting, neuropathy pain, reducing anxiety and stress, and then just general pain, osteoarthritis. Like that list is comprehensive. That's one from Penn Medicine that they're putting that list out there in general, what they do at their individual clinics. But I guess
Yeah.
that's a great one for patients to think, what could I use acupuncture for? Why should I try it? If these medications, either one, aren't working, or two, I should try this before taking medications to just avoid them altogether.
Yeah.
On the clinician side, Bernadette, what would you recommend? Like, what should the average clinician, look into to feel a little stronger about what acupuncture is and feel more comfortable about it? Any recommended readings or any literature or any little tidbits or nuggets of knowledge to pass on to them?
I mean, I mentioned The Spark in the Machine. I think that's a great, pretty digestible book for patients to look into. I think it's also really important just to keep an eye on like current literature about, lifestyle factors that can be used. I think
Mhm.
it's also, again, a lot of it's like word of mouth, like you said. Like you hear people always say, like, oh, you should see an acupuncturist for that. Or have you thought about acupuncture? And I think continuing to connect with people and share these experiences is really important as well. I think I was listening to a previous podcast that you guys had done, and it was lovely. And I also wanted to highlight one of the benefits of acupuncture is there is the option of community acupuncture. And I think that's something that's really powerful for patients. And it's delivered in a variety of settings. Some practices are community alone, and there's other opportunities for patients to come together. Maybe they're cancer patients. They're going through various stages of their cancer treatment, and acupuncture is playing a role in that journey with them. And
Wow.
how empowering is it to share that experience with other people going through your journey, seeing people that have been through what you've been through, and being able to be there for people that haven't gotten to your point in treatment either. It's also very useful as well, like Dr. Bartlett was saying, for reproductive health or fertility. Um, there's all sorts of it's medicine. It's just
Mhm.
it's just not our form of traditional medicine in this country. It's just, but we're
Beautiful.
slowly bringing it in. So there we go.
Yeah.
Yeah, I think the word of mouth piece, Donna, to me kind of speaks volumes because not to go negative toward the end of the show, but the the medical system is not incentivized to bring in acupuncture, right? I mean,
Yeah.
when your doctor is going to the office, there isn't an acupuncturist that is giving them a X% cut of whatever they're recommending for them to go. The pharmacist walking someone down the aisle, there's an OTC that they can sell. The acupuncturist, they can't directly sell. So intentional or non-intentional for our medical system, it's not set up to bring or to collaborate with some of the other practitioners. So I think it really is not only a word of mouth, but also us to push ourselves a little bit further in the profession of how do we truly help patients, and maybe a calling for patients to feel more empowered to go, sometimes I need to do things on my own. Like sometimes there won't be things that are logical for medical practitioners to think this is the next step. And I'm going to have to do what Bernadette did and listen to my body and think maybe there's an alternative way to go about it. But Donna, any other closing words for you before we pass it off to Bernadette?
Yeah, actually, just to add to your comment, I do think that they are starting to bring some acupuncture into the hospitals, if I have that right, especially for pain, I think is what they might be using it for. I the odd thing for me to know that there is some of that happening when you go to an acupuncture clinic and you're in a treatment room. It's zen. It's beautiful. It's wonderful. It's so calming. I'm like, I don't know how they do this in a hospital with all the bells and whistles and everything else going on. Like, I don't know if I could relax if it was me, but I find that like, wow, that's amazing if acupuncture can be successful in that setting, which it must be if they're doing battlefield acupuncture too.
So true.
Yeah.
Bernadette, any closing commentary from you on anything that's on your heart?
Thank you again for having me. This is a really awesome opportunity, Dr. Bartlett. I appreciate you as always. So thank you for your collaboration in the past. And I am optimistic for the integration of acupuncture into our hospital system, as I've seen attitudes change just even between my coworkers and people that I know. Um, I think the future is bright. So, and I highly encourage any patients listening or anyone listening that thinks that acupuncture might be something that they want to pursue. It's something you can easily look into, and you can connect with people and see who you want to work with. So, and best of luck to everyone on that journey.
And Bernadette, I have to say too, between our collaboration, I think that there's a bright spot too with pharmacists and acupuncture. I think everyone thinks we're so different and like our worlds just would not combine at all. And I think it's a perfect match like we found. So I'm hopeful that that happens too, where more pharmacy and acupuncture work together to have
I
great,
think that would be great.
yeah.
Awesome. If you're out there listening, there's the challenge. Make that happen. Let's get it done and do a little more collaborating. How much fun. Bernadette, thank you so much for your time. And thank you for kicking off the second season of the Med List. We'll talk to everybody soon. Have a great rest of the day.